You know, Hollywood has done a good job of convincing people that mental health professionals like myself are scary types of people who are going to, I don't know what, put you in the hospital or institutionalize you or take your kids away from you if you say the wrong thing. And it has caused a lot of people to be very concerned about seeking professional help when they need to. Well, I'm here today to tell you that there's a lot of myths and that you shouldn't be scared of taking your kid in to see someone like me. Let's talk more. Hi out there. This is Dr. Brett Pearce, child psychologist, and I'm coming at you with a video in which I am going to promote the use of mental health services and more or less try to dispel interesting myths that people seem to hold about mental health therapy and services in general. And these myths tend to be understandable sources of anxiety for many people. Mostly, I'm going to say that Hollywood seems to be responsible for a lot of these myths. Not that I have an objection to Hollywood per se. But people out there seem to be real nervous about seeking mental health services for themselves or for their kids. And since I'm primarily a child psychologist, I guess we'll say for your kid, just for the purpose of today's video. So there's some very interesting representations of mental health professionals in the media. In some cases, it's fine for kind of like effect. I'm a big fan of horror movies myself, and so I see a lot of mental health professionals depicted in horror movies. And there's lots of interesting things that happen with mental health professionals in movies, many of which are very, very, very much not true. And I think some of these things have resulted in people becoming overly concerned about seeking professional help for their kids. And so it's time for us to, oh man, I can't get my phone, because yes, I just film on my phone to stay steady on its mount. So let's talk about the first myth. So the first myth is that a mental health professional can just put you in an institution or a hospital more or less at their whim, or perhaps because you said something weird or strange that in some way, shape, form, or size called your mental health into question. This is completely and utterly a myth. Absolutely. Almost to the point of being, frankly, kind of cartoonishly strange. So it is true that in most jurisdictions, and by jurisdictions I'm referring to states, because generally speaking, states are the legal jurisdictional entity that gets to dictate how different laws work in their, state. So generally speaking, though, mental health professionals can help facilitate someone going into the hospital against their wishes in really extreme circumstances, when someone is imminently considered to be a threat to themselves or others. And generally speaking, that can only truly happen with the, what am I trying to say? Just only at the whim or at the judgment of, or whatever, of the single mental health professional in some really exotic circumstances. Here in the state of Utah, someone has to be certified as a mental health officer, I believe, in order to do what's called pink sheet someone into the hospital. It's kind of an obscure thing that I've basically never seen happen. My current boss, I believe, has that certification, and I currently work for a community mental health agency that often has to be of assistance with folks who are extraordinarily severely mentally ill, where it would make sense to have some people who work there able to do that. So we're talking really exotic circumstances where someone is imminently considered a threat to themselves or others via things like intense suicidality, intense homicidality, or maybe super active psychosis, or perhaps a really severe manic episode or something like that. And this is the same for a kid, by the way. So the idea that you see often in movies and things like that, where someone is seeing a mental health professional and they sort of said something weird, or maybe said that they, you know, believe in psychic phenomenon, or that they, you know, have a deck of tarot cards or something like that. Not that I'm knocking any of those things, but that's what resulted in them being put in an institution for 4 years is very strange. It is exotically rare for people to receive truly long-term residential psychiatric care that is involuntary. It's extraordinarily exotic, and it only happens in really, really intense circumstances. So that's basically myth number one that I think keeps people away from seeing a mental health professional, especially with their kids, is they're like, you're going to put them in an institution and I won't see them again, or something like that. I mean, it's an understandable thing to be afraid of, but that's not how it works at all. And the only time that any mental health professional with just even a half of an ounce of competence and integrity is going to start to push for that, and by that I mean even something like a couple of days in the hospital, is when we really, really think that it's important to protect someone's life, more or less. The second myth that I hear a lot about is that people think that we mental health professionals have the ability to take your kids away from you, which is, of course, a very, very frightening and devastating thought. And the answer to that is no, we don't. Not in so many words, and not in any direct way at all. Basically, in about every jurisdiction I'm familiar with, mental health professionals are considered what are called mandated reporters to local child and protective services agencies. These are government agencies, and we are often legally required to make a report to these agencies if we are concerned or suspicious about the presence of something like abuse or neglect towards a minor, and then often also towards disabled adults or elderly persons. And so if that does occur, we make a report to that agency, and it is up to that agency to do what they're going to do with that report. We mental health professionals are not law enforcement officers. We're not agents of the government in that sense. We just aren't. I mean, at best, in circumstances when we're really, really concerned, we'll make a report. And again, any mental health professional with half an ounce of integrity and half an ounce of competence is only going to be pushing that button, as it were, in circumstances when we're really concerned that there's something really remiss going on with a child. Really concerned. It is something we take extraordinarily seriously. I can't tell you how many times I myself have gone to or had other professionals come to me saying, I'm really concerned about this situation. What do you think? Should I make a report? We take it extraordinarily seriously. It's just not something we toss around. And even so, it is not up to us to take people's kids away. And it has been my experience that child protective service agencies are comparably extraordinarily careful about doing that, even when a report has been filed that is considered by them to be something that needs to be followed up on. So we mental health professionals are not capable, in so many words, of having your kids taken away from you. And that we only make reports to express concerns about something remiss going on when there's really obvious concerns about things like abuse and neglect. I had a friend recently express concerns to me that he felt like if he went to a mental health professional to work on his own personal therapy, that because he went through some things as a kid, that his therapist might say, oh, well, you must be unfit as a father because you went through some stuff as a kid that you've come to me to work on. And I can totally understand the fears and concerns one would have about doing really hard work in therapy and what might happen. However, these fears are so far and away beyond what actually happens in mental health practice and what actually could happen in mental health practice, that it was difficult for me to know what to say to him other than just like, I'm sorry, I don't know what else to tell you other than that doesn't happen. And let me tell you the circumstances under which someone would maybe be legally obligated to express concerns. And we're talking about clear suspicions about abuse and neglect, not because some father or parent or mother or whoever came in and said, wow, I'm noticing that I've got some stuff to work on in terms of my own mental health. I mean, almost. I think most sensible mental health professionals would consider that the opposite of a concern about someone's sort of fitness, if we want to put it in those terms, because you're talking about someone who's willing to come in and address those things, rather than not addressing them, I guess. So that's another one, is that people think that mental health professionals are going to take your kids away from you, and it's just a myth. So the third one we'll talk about, third and final myth that I think is important to address in this video, is that mental health professionals are capable of forcibly medicating people. Now, again, I think you see this a lot in Hollywood, particularly in like thriller and kind of horror and psychological suspense movies and things like that, which are awesome. I love them. I have quite a collection of them myself. They're one of my favorite things to watch. However, there is a little thing out there called a code of ethics, and it is not just a bunch of bureaucratic gobbledygook. It's not perfect, but it's not just gobbledygook. I mean, in our code of ethics as mental health professionals, certainly as a psychologist, I can speak to my own, we are required to have consent from people. And again, this isn't just a buzzword. I've been in circumstances where I have chosen not to proceed with something because I felt like the person truly wasn't really truly consenting in an informed fashion. Even when other people around the person who had great intentions were saying, no, he really needs this service. And I sat down with the person and more or less decided, I don't think they're really saying yes. Bottom line is, there's nothing that I've ever seen or known or anything that says that someone can be forcibly medicated against their wishes, again, unless we're talking about someone who is imminently and obviously a threat to themselves or others. So I would sense, and I'm a psychologist, not a psychiatrist, meaning I'm a doctoral level therapist and evaluator and assessment type of mental health professional. I'm not a physician. But what I would understand, and someone can, give me some comments and correct me if I'm wrong, is that the only time that could happen medically is if someone were like clearly out of control, an obvious danger to themselves or others, probably in a hospital or something like that. I think you might see those things happen, maybe. But what I understand from, because I have worked with prescribing mental health professionals like psychiatrists and nurse practitioners, I mean, it's just something that is exotically rare in the most intensive circumstances, and it is regarded as something to be taken with the utmost care and reverence and caution, if at all, from what I understand. But the bottom line is, no one is going to force medication on your kids. In fact, a great many mental health professionals, including prescribers, in my experience, are pretty careful about that. They want to say, okay, well, are you also seeing a therapist? Have you explored your options? All right, let's talk about a low dose of medication if that's what you really want, and things like that. I myself am relatively conservative about making referrals to medication management. I think it's a fine option. I don't think there's anything wrong with it. It's a completely legitimate treatment option. It's got a lot of good established evidence and research supporting it. But it's not something the very second I sit down with someone's kid and say, yeah, I think this kid's got some anxiety problems, I'm not instantly going, get him into, get him in to get medicine right now or else. I'm not doing anything like that. Generally speaking, I'm just presenting folks, parents that is, their options and saying, hey, this is a treatment approach, here's another treatment approach. I'll often say things like, research shows that the combination of two, that is to say therapy and medicine, tends to work better together than either one in isolation. And then I'll say things like, medicine tends to work, but when you stop taking the medicine, research shows that the benefits you derive from that medication may not stick around. Whereas with therapy, if you've gone and done the work, which is not easy and sometimes takes a while, then the benefits, though, tend to stick around when you stop therapy, because you've kind of learned new skills and things like that you still have. So, but yeah, the whole idea that a mental health professional is just going to like automatically, or even can automatically, put your kid on meds against your wishes, it's just not true in anything other than the most outrageous of situations. And then even then, I've never actually heard of it. Well, I guess maybe I sort of have, like in a circumstance where someone was, just out. I mean, we're talking probably actively psychotic and was really a danger to themselves or others because of it, and ended up having to go to a hospital. Maybe I've heard of that like once in my career thus far. And between graduate school, practicum, and practice as a licensed psychologist, I've been doing this for a minute, like 15 years. Geez, I'm dating myself. But I think I've heard of it maybe once. So at any rate, I hope that this is helpful to some folks out there, because there are many folks who really, really should be taking their kids in to see mental health professionals because of things like emotional and behavioral problems or developmental concerns you might have about your children. And I think it's important to understand that these concerns about kids being institutionalized against someone's wishes, especially for the long term, about kids being taken away from parents just because the mental health professional thinks the parent's strange or something like that, and also kids being forcibly medicated against parents' wishes, they're just myths. They're absolutely myths, and they can act as barriers for people getting the help that they really need. So thanks for listening, and feel free to hit subscribe down below if you found this video to be of use. Beyond that, this is Dr. Brett Pearce, child psychologist, about ready to sign out. We'll see you in the next one. Bye.